I'm Neal O'Neal, an osteopathically trained manual physical therapist, and what to expect on your first visit here is that you'll be thoroughly evaluated. I don't care where your pain is from the standpoint of I have to evaluate your entire body to know what's going on. All the body parts work together. For example, I've never seen a shoulder or a neck walk itself down the street without the rest of the body attached. Obviously, the closer something is to the ground, the more effect it has on the rest of the body from a walking, standing, upright consideration. However, balance and eye level requires you to have top-down control. So you have to look at the entire body. So what you're going to expect in your first visit is you will be thoroughly evaluated. We will check your hips, and we'll see sometimes that a hip does not rotate. At 0 degrees, we'll look at different places. You can see that the range of motion in this direction is supposed to be the same that it is that direction. That's a dysfunction. So those are things we're going to check. We are going to check your pelvis to make sure that your pelvis works. You can see that when I push on this side, that's bouncing. When I push on that side, it doesn't function right. It's stiff here. When someone's laying down, none of the joints should be engaged. If the joints are engaged, that's dysfunction. So we go through the body and look for the dysfunction and try to meet that together with the symptoms and what we call signs of problems. So as we assess you, we look for what's not going to work. We have to evaluate, do your feet and ankles work? Do you have the full range of motion? Do you have the range of motion to maintain a flat earth to walk upon? If you don't, it's not going to work. Let's have you on your stomach. So there are multiple evaluations that we're going to do, multiple assessments. We're going to look at various things. We'll look at your hips, we'll look at your back. You can see that my patient here has a rotated lumbar spine. What that's going to do is it's going to cause chronic shoulder pain. Since it's rotated this way, he's going to rotate that way. He's going to have a whole lot of problem up in here. You can see how the neck and shoulders and mid-back. So we are going to look at every level of your spine, make sure that they're working in various angles. So we assess muscles, we assess ligaments, tendons, joints, the placement of bones. But at the end of the day, we're really assessing your body's neurological system and how it integrates information from below to above and from above to below. We bring that all together and try to craft a treatment regimen for you that will really address the root cause of your dysfunction. Everybody wants to talk about they get to root causes and then they still do the same medical thing of drawing a 6-inch box around the pain and try and treat within that box. That's not going to be effective because, again, no shoulder's ever walked into the clinic on its own. It's always attached to this body. And you can see if a patient has a shoulder pain and their hips are completely like this, you can see that until we get those hips level, you're never going to fix this shoulder because the hips will drag the shoulder back out and put it in a disadvantaged position. Same thing with the neck on your back. Okay, let's have you flip around, head down here. So we are going to look at your ability to level your head, move your head. So not just the range of motion, not just the strength, the neurological integration of these parts. We're going to check like how well does the shoulder work. You can see that shoulder is not stiff there. It is stiff in that function. We're going to assess your ability to breathe. Take a nice deep breath. And on this consideration, the chest is twisting. Well, if the chest is twisting, that means there's no support underneath these shoulders. The chest has to be able to stay in the middle. It has to be able to maintain midline without rotating out of it. And this patient is not. We have to check your diaphragm. Take a deep breath. We can see that on the right side, the diaphragms should both push down. So the right side's working, and the left side's not coming down. Again, back to if the pelvis and the thorax can't line themselves up in space, you're going to see symptoms in all sorts of places. Feet, knees, hips, shoulders, backs, mid-backs, heads, necks, or all sorts of odd things that happen too, as well as choking and things like that. That's what to expect on your first visit here, and then your treatment regimen will be based upon that. Of course, taking into what your actual diagnosis is from the physician and saying, what are all these things that are contributing to this problem? How do we get those out of the way? What's your home program for that? So that we can properly address this. Anybody can treat within the 6-inch box. Not everybody thinks around the entire body and says, how do I make that 6-inch box have no external forces acting upon it to make any treatment there, including surgical, whether that's a cortisone, including cortisone shots, PRP, whatever, or any exercises that you might get for your shoulder. Those shoulder exercises cannot overcome dysfunction in the rest of the body. Everything else has to be zeroed out so that we can focus on where the problem lets you know that it's a problem, right? This is the light on the dashboard saying, I have a problem. You don't go beat up the dashboard to say, okay, I'm going to fix that red light, we're going to kill it. You go and look at what's going on in the rest of the car. Why would we treat humans any differently? So that's what you get when you come to pursue physical therapy, and hope to see you later.